On this episode of Clear the Air,
You know what? Get the juice and the soda pop and the milk out of the sippy cups, okay? The only thing that should ever be put into a sippy cup is water. I think we had a discussion a couple of weeks ago about the World Health Organization and this new treaty they were trying to push through. Gladly it failed because I read through it and it was 36 pages of how they wanted everybody to fund the money to pay. We're talking hundreds of billions of dollars to treat the next pandemic, and it had two lines, one sentence, on what they were going to do with public health to prevent the next pandemic. And Bernie, I hope you watch this, and when you do, call me. Hello, and welcome to another episode of Clear the Air podcast. I'm here with Joel.
Hey, everybody. I'm here, too.
Well, thanks for being here.
Yes.
And today what we're going to be talking about is government involvement in healthcare. I recently read an article in USA Today. Hopefully you guys can put this on there, and we'll show it to you later. But this is why Bernie Sanders is targeting oral health. Dental care in America is in crisis. And let me tell you, I agree with that statement because it is in crisis. And it's not something new. It's something that we've known for over 25 years. Okay, a quarter of a century, dental care in America has been in crisis. We haven't done crap about it. Okay? I was going to use the S word, but I refrained. I'm keeping it clean.
Thank you.
You know, in 2000, there was actually a paper written by the Surgeon General, I believe it was Sanger, if I'm right, but it was a long report. And it actually talked about how the incidence of caries in the United States and the incidence of positive health outcomes from oral care was actually declining. And it goes through in pages and pages and talks about smoking. It talks about drug use. It talks about all kinds of things. The one thing that it really didn't, go into detail about was sugar. It didn't talk about sugar, which everybody knows is the number one cause of tooth decay. So before we really get in and dive into some of this, I really want to explain the process of tooth decay and how that is, because there's other diseases, there's periodontal disease and all these other things, but a lot of them, most of them actually, they all have similar genesis. They all come from the similar things. And really what you have is you have three things you have that you have to have for tooth decay. You have to have bacteria, which is going to be usually strep mutans. And then you have time. And then over here, you have cavities. You have to have all of these together to create caries, because that is where the decay, this is where it happens. You have to have bacteria. They have to have carbohydrates to eat. And because the bacteria, the strep mutans, they eat carbohydrates. They eat sugar, 6 carbon sugars, and they break those down. And the process of them breaking that down, they excrete acid. And that acid is what lowers the pH in your mouth and dissolves the enamel of your teeth. And you need time for that to happen. It just doesn't happen in, one day. It's not like a knife or a paper cutting into you. Yet it takes time. And one of the other things that they put in here and they talk about is you actually need a tooth. So
That would help.
But this is really a diagram of tooth decay. That's how they teach it in dental schools and in the dental hygiene schools. So I thought I'd start with that. And we have known for decades that public health or that the incidence of tooth decay and the incidence of oral care has been declining. We've known since 2000 that the poor oral health status in the United States is leading to more significant systemic illnesses. We know there's a plethora of systemic illnesses that can all be traced back, or they have roots in oral diseases. We're not saying it's causing it, but there is a correlation which would suggest that there's something in there that could be looked at. But we know that obesity, people that have poor oral health, are usually more obese. They have higher incidence of diabetes, Alzheimer's, heart disease, all of these other things. And I think I've described these in some of the other podcasts. You can go in and look at them. But what I want to talk about is Bernie and his wanting to do good, and how him wanting to do good is really just driving the problem and making it more expensive and worse. Because what he says today, and this is a USA Today report, paper that I read. Hopefully they're all good with it. It's on the paper right there. And Bernie, he just looks like a happy camper in that picture. But This says that in May, the Vermont Independent introduced the Comprehensive Dental Care Reform Act of 2024, a bill to expand dental coverage through Medicare, Medicaid, and the Veterans Administration, which all sounds good. Okay? And then it goes down here and it says, the Senate Committee on Health, Education, Labor, and Pensions you chair recently held a hearing on dental care in the United States. Why are you highlighting this topic? And Bernie says, the first thing that we are trying to do is make it clear to the American people that dental care in America is in crisis. Well, Bernie, you're only 25 years late. Millions of people can't afford insurance, but I think that is not the same consciousness with regard to dental care. And that's what this hearing was about. And the reality is that dental care in America is extremely expensive. Many dentists do not accept Medicaid reimbursements, et cetera. You know what's not expensive? $25 a year of chewing gum.
Chewing gum, yes.
Okay? USA Today then asks, how was lack of dental care access affecting vulnerable populations? The result is that 40% of kids in America have tooth decay by the time they reach kindergarten. Okay, that's a pretty high number. You know what? Get the juice and the soda pop and the milk out of the sippy cups. Okay, the only thing that should ever be put into a sippy cup is water. And the reason why, this is a dentist, a pediatric dentist explained this to me, and it makes so much sense. I just can't understand why the dental professions aren't educating people. Because if you put sugar or milk or soda or anything except water in a sippy cup, that all has sugar in it. And the kids, they set down the sippy cup, they run around, they play, they come back and they drink. They go around, play, they come back and drink. And it just keeps it there, and you just keep assaulting your teeth over and over and over and over. And that's why they have tooth decay. You put water in that, you're washing that out. The kids are still going to come back and drink it. Yeah, we all like sugary water better than we like water. But you're the adult, you know.
So you're nailing two of those at least. The time, as you keep on repeating the introduction of that, and the carbohydrates.
And everybody has strep.
And strep is
So
always
you already
there.
have that.
Yeah.
You get it from your parents.
You get all three of them.
Correct. And so that is something that we need to do. And what Bernie is suggesting, while it sounds good, isn't something that is going to solve the problem. It's something that's just going to make it more expensive. Okay? Because you're not going in and preventing it. You're saying, hey, let's go in and pay more money to have it repaired and fixed at the end. And I didn't see anything in here where they come in here and they talk about ways and what they're going to do to prevent it. I mean, I would love to see that. I think, I think we had a discussion a couple weeks ago about the World Health Organization and this new treaty they were trying to push through. Gladly it failed because I read through it, and it was 36 pages of how they wanted everybody to fund the money to pay to treat. And on a global scale, we're talking hundreds of billions of dollars to treat the next pandemic, and it had two lines, one sentence, on what they were going to do with public health to prevent the next pandemic.
So I see a pattern here. When it's your own money or your own things involved, you are absolutely concerned about prevention. When it's someone else's money or someone else's thing, you only worry about when it happens and you treat it.
Kind of, I guess. I mean,
I check the oil in my car to make sure that it's still there.
Yeah,
but when I get a rental car.
But the government doesn't care about you.
Right. So they're using my money. They're using someone else's money. So they
That's
wait
true.
till it gets there and they just treat. If it were me and I had control fully of my mouth, you bet. Prevention, I go to the dentist, I go to cleanings, I do all of that.
Yeah,
And
so Bernie, I know you're watching. Bernie, let's talk about prevention, okay? In your bill, the Comprehensive Dental Care Reform, let's put a little bit of time and effort into prevention. Let's put a little bit of time and effort into teaching people that if they chew xylitol gum, they don't get tooth decay. This isn't anything new. We've known this for 35 years. We've known this since you were a young man, Bernie. Just saying. Anyway, since 19. He was young back 50 years ago.
Yes, he was. Yep.
The other thing, he talks about 40% of the kids having it. The USA Today says the Affordable Care Act extended coverage for medical care to many Americans. Why does dental care not get the same attention? That I actually agree with. I mean, the Affordable Care Act, again, whenever there's legislation passed, you know it's going to do the opposite of what it says. So this made health care in America doubly expensive. When this Affordable Health Care Act passed, I understand the altruistic nature of it and trying to help people have health care, but it took our GDP. It took us from 10% to 20% of our GDP is now in health care.
Well, it seems interesting that we're willing to withstand pain or any discomfort in our mouth and prolong that personally, which falls in line with this. But if we have any other pain in our back or our stomach or our legs, we go rush to the doctor. But we leave dental care for a long, long time, longer than it should be. And I think that contributes partially to that. To me, the prevention should be the biggest effort we make in teaching and doing prevention methods, and then likely see the rest of it trickle down to almost nothing.
Yeah. Well, I'm going to read this here because this is a good one. USA Today asked Bernie, they said, the Affordable Care Act extended coverage for medical care to many Americans. Why does dental care not get the same attention? And Bernie's good answer was this. The American healthcare system is broken. It is dysfunctional. It is cruel. The function of the American healthcare system is not to provide quality healthcare or dental care to all people. It is to make huge profits for insurance companies, drug companies, and in many cases, providers. That's its function, and in that sense, it does very well. But it is failing ordinary Americans in a disgraceful way. We're the only major country on earth not to guarantee healthcare to all people. And Bernie, by going out there and putting all this time and effort and money into treating caries, you're perpetuating the as you said, it's cruel, the dysfunction. We need to take that money and put it toward prevention, put it toward programs where we can actually stop people from needing to go see dentists and doctors later on. And and that's one of the things we want to do. I mean, even during 2020, I mean, I'll go back. I mentioned the Surgeon General report of 2000. This was really interesting because in 2021, the Surgeon General Vivek Murthy, I love saying his name simply because he did as much to propagate the COVID pandemic as Anthony Fauci. He just gets away with it. But he and Francis Collins actually wrote a paper in 2021 where they pointed out the same thing, that even in 2021, 21 years after the Surgeon General had written, David Satcher had written his report on oral care, they came out and had written more and said, yeah, it's failing. We need to spend more money on research. It isn't that we need to spend more money on research. We need to spend more money implementing what we do already know. We've known that xylitol prevents tooth decay. We know how to prevent tooth decay. We're choosing not to. But the other point of this is this came out in the middle of COVID. And there were papers during COVID that came out where they actually showed that people who had periodontal disease, which is really easy to treat, it's just inflammation in the gums. But they had studies that came out that showed that people who had COVID or people that had periodontal disease were 9 times more likely to be hospitalized and die from COVID. And I didn't see Vivek Murthy or Francis Collins out there telling people to brush their teeth.
Right.
What their response was, hey, we need to spend more money researching other things so that we know more that we don't know that we don't want to implement.
So, yeah, the implementation was the struggle. I think that's what we noticed in a lot of it, whether it was comorbidity of any other disease or anything that would cause that. But you're right there. Why? The question still remains, why aren't they implementing? We know these things, and so the silly thing is that they want to do more studies just to tell them what they already knew.
I think they want to do more studies to learn more things that they can, not implement.
Yeah.
Counting all the illnesses and researching all the illnesses and the dollars you're spending on it is way easier than actually implementing and living by what you know.
So they're gaining all this knowledge just to have it and not implement it.
Correct. And in many cases, coming back full circle, when companies try to share that data, like us, the government sues you for sharing that published data. That's really the way it works. But hopefully when they put this podcast up, they'll put up links to some of these papers, because some of these papers are really, truly eye-opening as to how dysfunctional, not just healthcare, but extremely dysfunctional public health agencies are in the United States. And I really do hope that they can get those fixed and change those so that they can actually go out and help people to live better and healthier lives.
Well, it's obviously a big issue, and it's for those who don't know, when you're a private citizen and you just feel like you've got a toothache or something, you go and treat that. I think we've gone way beyond brushing and flossing, right? That's been the age-old answer. Brush and floss. If you have some pain in your mouth, go see a dentist and get it taken care of. Hopefully. There are still some who aren't going to that. But we're way beyond that message if they were to implement everything we know. So there is probably volumes of information, because each time, as you say, they go want to do a study for it to make themselves feel good about what they aren't going to implement. And so I think if we can get past that point and start implementing, it would pay to have someone go through those studies and say, all right, these are the things we've learned. How come we're not doing this? Let's start implementing these. And it isn't even a money issue. I mean, if they're still going to spend money on it, like was said, move it to the front side as your diagram in the last podcast.
I think if they could spend even half, if the NIH took half of the money that it was spending on research, I mean, who really needs to know how many tsetse flies it takes to bite a beagle before it dies? Do we really need to know that? That was millions of dollars that we could have actually spent implementing hygiene programs in schools, but yet our government chose to spend our money that we paid in taxes trying to find out how many tsetse flies it takes to bite a beagle before it dies. And in case you don't know what I'm referring to, that was a study that, yes, our government paid for. You can go look it up. But they were paying for flies to bite a dog, and they cut the dog's vocal cords so they didn't bark a lot. And that was a big
Interesting
question, but that is a true thing.
Since we paid for it, they should be sharing that information with all of us.
I know. That way I can make sure that my dogs don't get bitten by that many flies.
That's right. Yeah.
I don't have dogs. I like dogs, but I travel too much, and
No one to watch the dogs.
I didn't want to make them die of loneliness when I was always gone.
Yeah.
So anyway,
You should do a study about that.
I'm good. The way our government funds studies, I can't afford to do a study. The studies really have to be done by the government. We can do studies. It's just we have to go outside the country to get them done because here in the U.S. the cost of them has been driven up so much.
Too much red tape.
It's ridiculous.
So how does this whole picture work? If the government's still running public health care, what would you do as a private business owner? How do we go around? How do we get through? I mean, you spend a lot of time in D.C. You're with a lot of legislators. You're doing a lot of that. Is there anything you can think of that we can start educating the public? How do we get them to make this happen?
I think there's a lot of, and Bernie, I hope you watch this, and when you do, call me. But I think there's a big issue because a lot of government agencies will actually go after companies for trying to share this data because the definition of a drug and a supplement or a hygiene product, it isn't that it's here's a drug and here's a hygiene product and here's a supplement and here's a nutritional product. It's blurry lines all the way across there. I mean, if you go way out here and say, okay, we're using chemotherapy, well, that's obviously a drug. That's way over there. But if you're sitting here and using turmeric, turmeric could be considered a drug because it's anti-inflammatory. It has other things, but it's also considered a supplement. Hygiene tools, by the very nature of them, are in that gray area because the definition of a hygiene product is, it's an action of cleanliness or, soap or, something you're using to improve cleanliness, to improve a health outcome, which by the FDA's definition makes all of your hygiene products drugs, which is kind of ridiculous if you ask me. But they don't fall into the same, OTC or script or, medical devices. They're outside of that. And even outside of that, your soaps and your cosmetics, our nasal spray is considered a cosmetic because it washes. It washes bacteria, it washes viruses, it washes pollutants out of your upper airway. It blocks adhesion, helps them facilitate that cleansing. So they're considered cosmetics. And so but we can't go out and say that washing all this stuff out of your nose is going to help you. So
I'm not a doctor and I haven't played one on TV, but what I gather from you is research as the general public, research sanitation and personal hygiene, and research it more and more and more. It's more than just washing your face. It's more than just washing your hands when they're dirty. All of the surrounding areas that build up personal hygiene, and you may find it a lot. You've said it before. I agree. There is a place for medicine. There is a place for drugs, pharmaceuticals, all of that. But there is also a big place for hygiene, and that should be front-loaded in all of our aspect of it. Hygiene should be the biggest thing with sanitation.
Hygiene, sanitation, nutrition, exercise. Those are what I believe that public health should only be able to talk about those four things. I don't think they should be able to talk about drugs at all because you're going to get the influence of drugs into that, and it's always easy to crutch back to the easiest thing to do, and it's always easiest to crutch off to a drug and say, just go take a magic pill and be better.
I agree. So my last question is it too late to run for a president?
Only if I can skip the whole primary process. You know, I think everything that's happening in our politics is a tragedy. You know, I'm an equal opportunity questioner. I'm like, what the heck is going on? But we don't need to get in on that.
No.
I just like to talk about public health and how we can make public health better. And public health should not be political. Public health shouldn't be driven by whether you're a left or a right, a Democrat, an independent, Republican, or an atheist, or a Muslim or a Christian. Public health is public health.
You're human.
You're a human. You know, we all understand that you know, hygiene matters. We understand that brushing our teeth helps. We understand that washing our nose helps, that washing our hands, that taking a shower every now and then helps. We've known this for hundreds, if not thousands of years. Okay, thousands. We've known it for thousands. I really am looking forward to Bernie calling me. And until he calls me, we won't bring up his name again. But Bernie, my number, 555-555-5555. No, I'm kidding. Bernie, you know how to get a hold of me. I would love to talk to you and give you some advice on how to make this actually better, how to make the Comprehensive Dental Care Reform and Education Act better, because I want you to educate, because that's important, making sure that these people have equal access to prevention, not just treatment. And unless you have something else to add?
Well, I think the final note for me is the 4 pillars you mentioned in every aspect of your healthcare: oral, physical health, mental health, hygiene, sanitation, exercise, and nutrition. Maybe
Correct.
in different, that's the order, but that's the 4 things. So before you go somewhere next, figure those things out.
And the other thing that we kind of dream about talking about in that, the 5th pillar, sleep. You gotta sleep.
You gotta sleep.
But we don't like talking about sleep because, if you ask me, that's just a third of my life wasted. There's plenty of time to sleep when you're dead, so I try not to sleep that much. Anyways, that's another episode of Clear the Air podcast. Hopefully you learned something, and any of you know Bernie, tell him to call me. Thank you.
Thank you.
This episode was hosted by Nathan Jones, co-hosted by Joel Melton, produced by David Monk. Associate producer, Matthew Davis. Video and audio were edited by Caleb Scoresby. Research by Saber Bills. Graphics by Joseph Thornton. Music by Augusto Diniz. If you enjoyed this episode of Clear the Air, be sure to follow, like, and subscribe so you don't miss out on the latest episode. Have a favorite episode? Share it with a friend or on social media. New episodes of Clear the Air are published weekly on YouTube, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks for listening. We'll catch you next time.
I thought you were drawing a Venn diagram
I am.
because you love Venn diagrams.
I know I love diagrams. I love graphs. And then over here, how did I get that to blue? I thought that was purple. And then over here, you have again my handwriting, and I apologize. My handwriting is horrible.